Hey folks, we're in for a real treat in this audio version of the ownR magazine. I have none other than Dr. Mark Costas on the line with me. Dr. Costas, thank you so much for taking the time out of your busy schedule to sit down and talk with me.
Oh, thank you so much. I'm thrilled to be here, and geez, what an honor. Thank you for asking me.
Well, as I was telling you in the pre-interview, if you will, we were talking about who we would want for the cover of the first edition of our magazine, and the first person that came to mind was you. I admire what you've done in the business community, even outside of dentistry, that is, and you're such an influence on me, and I appreciate you taking the time to sit down and talk with me and go through these questions that I have to ask.
That means a lot coming from you, Dr. Russell. Appreciate it.
All right. I'm going to rapid fire throw these at you, and we'll just run through the list here that I have in my mind to try and give some insight as to private practice ownership from Dr. Mark Costas's perspective.
Sure.
Mark, first question is, why did you decide to go into private practice? Why did you decide to become a private practice owner?
Yeah, so entrepreneurship goes generationally. Back in my genes, my grandma. I hear stories about my grandma all the time, who was my mother's mom, who was the consummate entrepreneur, and she had lots of small businesses. She was a vendor. She did a little bit of hard money lending. That's the big joke in the family. She was a little bit of a loan shark.
Nice.
She sold ice. She sold water. She rented cars. So that goes way, way back in my genetics. I've always kind of been an entrepreneur at heart myself. I was just one of those kids that, traded baseball cards and had a paper route and figured out how to get the most leads for, my paper route and always did the lemonade stands and those sorts of things. So I've been an entrepreneur, I think, at heart my entire life. When I couldn't get into dental school, it took me 3 years and 21 attempts to get into dental school. I bought my own business. So I first got a really good opportunity to flex my entrepreneurial chops in a real way while I was trying to get into dental school. I bought a catering truck and a catering truck route. So, I had a cook. It was basically a restaurant on wheels. I had a cook in the back, and she was making meals and burritos and hamburgers and French fries, and we drive from construction site to construction site selling our food to the construction workers around San Diego. And that was my first toe dip into the world of entrepreneurship. So when I got into dental school finally, after all those tries, I knew that I was going to eventually be a private practice owner. And I knew even from a very early stage of my career that I wanted to own multiple practices.
So you were born for this, it sounds like.
Oh man, it's in my blood. It's in my blood. I love the business side of dentistry, and frankly, when I was trying to decide what I wanted to do, I knew I wanted to be in healthcare to some degree. When I was trying to decide whether or not I wanted to go into pharmacy or medicine or dentistry, because a lot of the same prerequisite classes are required, I decided on dentistry because I saw the writing on the wall that pharmacy, there's very few independent pharmacies now left in the world. They've all gone corporate. Very few private practitioners in medicine. Most of them work for either a huge group or work for a hospital. But dentistry at the time was very much a cottage industry, and it allowed much more opportunity to be a small business owner, and that's what really attracted me.
I feel the same way. My wife's a pharmacist. I know several physicians, and It's interesting how we've weathered that storm a little bit. I'm not sure how the future looks for us as the cottage industry, as you say, but I agree with you, and that was one of the reasons that when I was looking at healthcare as well, I looked at dentistry, because the quality of life too. Some of the physicians out there, they spend a lot of extra hours on call in the hospital, after hours in the evenings, on the weekends, and we have the luxury sometimes of having a little better quality of life from a scheduling standpoint.
I couldn't agree more. I really honestly do believe we have the best profession in the world. I wouldn't want to be a lawyer or an accountant or a pharmacist or a physician. I'm really glad that I chose dentistry, not just because of the entrepreneurial aspect of it, but as you said, the quality of life is so much better than other professions.
Now, did you have a mentor or some influence outside of your just own research that drove you to the dental profession?
When I was 16 years old, I was playing in my very first varsity baseball game ever. And we had moved from Tucson, Arizona to Southern California. So I was playing on a brand new field, a much shorter field, and I'm an outfielder. And my new field didn't have a warning track, didn't have a padded fence, unlike the previous field that I used to play on. And in that first game, I was a left fielder. This big kid gets up to bat and cracks one over the left field fence, and I'm sprinting towards the left field fence as a left fielder, waiting for my foot to hit the warning track so I could play this ball off the fence because I knew it was going to be close. But I never hit the warning track because this field didn't have a warning track.
You hit the wall.
I hit the wall face first, and broke my upper jaw, lost 6 through 11 or fractured off 6 through 11, completely avulsed 8 and 9. And it took an entire year to put my face back together, basically. So I was in and out of dental specialty offices, the general dental office, oral surgery, perio, ortho, endo, even a plastic surgeon. And over that 12-month period of time that it took to kind of get my face back together, I really grew a great appreciation for the profession of dentistry. It was a big turning point in my life. So those people became my mentors. And it was at that point that I decided that I wanted to become a dentist. And even though, this is a whole different story, but had some learning challenges, never was really diagnosed, but by definitely 100%, they would probably diagnose me with ADD at the time. Had some learning disabilities, some attention problems. So although I decided right then and there that year that I wanted to be a dentist, it was a challenge just because I didn't take traditional tests that well. Eventually we overcame all of that, and the rest is history. But the mentorships and the guidance that I got from those professionals, I maintained relationships with a lot of those people from back then. That's what got me through all of that.
That's a very interesting perspective. I didn't know that about you, and the fact that as owners, as dental professionals, that we could have an influence on somebody's life like that. You kind of I lose sight of that sometimes. And maybe there are more people out there that do the same thing. You don't realize what kind of positive influence you may be on someone just in your approach to a patient. Interesting.
Oh, it's so true. It's so true. We have a dental assisting school at our office, and we have been fortunate in that we have one of the biggest dental assisting school companies in the country. We have over 190 locations now of our dental assisting school company. But I still teach the dental assistants twice a week at my school, and several of them have gone on to hygiene. Several of them have gone on to become dental students, and it's crazy, how much of an influence you can actually have. And I spend a good amount of my spare time traveling around the country speaking for dental schools. I've spoken probably 20 plus dental schools to this point, and I just love to get out there, and it helps to keep me humble and remind me of the influence that so many of my mentors had when I was coming up in this profession.
Now, that's a nice segue into the next question I had on my mind was you're talking to dental students, you're going to the dental schools, you're speaking. Is this primarily related to the business aspect of our profession, or is it more clinical?
Yeah, it's almost 100% business. Right. I do talk about some clinical stuff. I talk about what I think are the important, if you're going to go into general dentistry, what I think are the most important clinical skills that you need to develop, which developing your clinical suite of deliverables. I do believe that you should be really, really proficient in surgery. You should be proficient in molar root canal. I think it's important to do some sort of potentially in the future advanced or even basic adult ortho, sleep dentistry is really important. So I talk about that on a very surface level, but really the theme of most of my discussions at dental school is talking about overhead, cash flow control, managing staff, just overall practice management.
Now, I know we've talked about this in the past, but what's your take on the dental school curriculum in preparing folks for business ownership or private practice ownership? I know I didn't have very much formal education from the dental school perspective on that, and I think you were in the MBA program as well.
I was getting my MBA while I owned my food truck, waiting to get into dental school. So I felt as though I really just had to get more education. So to your question, I do believe that the training that we have to prepare us for practice ownership is inadequate in dental school. But I want to give dental schools a pass because there's just so much to learn just to make us not dangerous, when we're actually out into the real world in those early years seeing live patients. So I get it. I get why there's less of an emphasis on the business aspect. I mean, they're not there to teach us how to be successful practice owners. They're there to teach us how to be not dangerous care providers, right? So that's their first priority. What I do think happens, though, and where I think so many schools are missing the boat, is that the actual curriculum. So if you do have, say, 1 full year of a practice management course, I don't think there's enough of an emphasis or enough research or enough involvement with the outside world and involving people that have done it successfully. There's a gentleman named Dr. David Dunning at the University of Nebraska. He's had me come and speak to his D4 students twice now at the University of Nebraska, and he is so cutting edge about the curriculum that he teaches. He has them run basically a simulated dental practice, and he puts certain challenges in front of them with their simulated practice. He says, here's how much you're collecting, here's how much you're producing. He poses real life scenarios as far as billing challenges, and your hygienist quits with 1 day notice, and your percentage for your payroll is this, your percentage for your lab supplies and your dental supplies is this much. Are you off, or is that right on? And those are the sorts of lessons, practical lessons that will actually help students when they graduate to run a successful dental practice. Now, I've been to other dental schools, my history included, where there's nothing similar to that at all. There's nothing practical. In fact, we had to write a business plan for our first dental practice with not a whole lot of guidance, but that was like a whole semester project, and that's all we did. So there was nothing that helped us as far as practical knowledge on how to run a dental practice. And I think a lot of the programs out there are lacking just real tangible training.
Yeah, and I'm in agreement with you. There's just so much clinical information and clinical skill sets that we have to at least get basic competency in. The room for the business aspect and the practice ownership and practice management aspect, it would extend the timeline that you would have to be in school, which would also extend or increase the cost, which is already pretty astronomical from the numbers I'm hearing for folks coming out of dental school now. So I can see it. I guess the question that begs the question then, well, how do we as practice owners that come out of dental school, if you're coming out and you want to go into practice, how do we gain those skills?
Yeah, I mean, it's all about self-education, right? So the very first book that I ever read when I was 15 years old was Think and Grow Rich by Napoleon Hill. So it was ingrained in me from my father and my family in general that there was a certain amount of self-education that we were responsible for that you probably weren't going to get in formal traditional settings. So it was always kind of ingrained in me that you had to go out there and get as much information and really just kind of self-educate yourself as much as possible. I think self-education is easier now for the dental student and for the young dentist than it's ever been, right? There's so much access to free information. There's so many dental podcasts. There's so many dental blogs. There's so many dental journals out there that you can access. This brand new magazine that you're starting is another type of those sorts of resources that are available. So I mean, self-education is huge. And if that means that you, until you can afford it, you just absorb and consume as much free stuff as you can get your hands on, and there's a lot of great free stuff, then that's your answer. And then once you finally graduate and you've consumed all the free stuff that you can find, and you have more than a couple pennies to rub together, and you can afford a coach or a consultant, then you join potentially a mastermind group or a coaching group like we have, or get a formal consultant. But there's really no way you can learn the information that you need to know, and have all the accountabilities and all the support that you need to run a successful practice all by yourself if you've never done it before. So self-education is a good first part. Then you got to find yourself a formal coaching relationship, I believe. And that's the only reason that I was able to survive and to build our group into several practices.
And I think the accountability piece there, when you have a coach, when you have that mastermind group that you're a part of, when you get to that point, agreed, the free resources are out there. Oh gosh, it's the technology that we have, such a leg up. To have had this when I started my practice would have been wonderful.
Yeah.
But that accountability piece, keeping yourself on track and doing the things that you need to do, it's an integral part of being successful in the long run. And I've had coaches myself, and I think that there's a certain point in time, especially with me, I plateaued in my practice, and I'm like, okay, I need to find out how I can improve this, and they help me, over the hump, if you will.
Yeah, totally. I mean, it's just such an overused analogy, but any of the best business minds have accountability partners, and they had to have a group of advisors. I sit on 3 different board of advisors for big dental companies, right? Because they want to know the perspective of the private practice owner. So they're looking for guidance, and these are multi-million-dollar companies, and they're looking for guidance, right? Mm-hmm. And every single athlete that is on the elite of the elite athletes, all the best of the best, all have coaches, no matter how good they are. It doesn't mean that their coach ever was as good of an athlete as they were, but they know how to hold them accountable and how to push their limits. Like I said, it's an overused analogy, but all the best of the best always has a coach pushing them, always has a group of advisors, and that's really just, it's so important, even as an owner of a single dental practice.
Agreed. And I tell you, you got me thinking about the coaching aspect. The virtual coaches out there and we're both podcasters, obviously, in the podcast community, with all the different information out there, you can have the virtual coach, multiple ones actually. Maybe not the accountability piece, but that could come later. But you could certainly learn a lot from all the information's out there. I listen to podcasts constantly, and I'm picking up bits and pieces all the time about, that would be a nice tweak to the practice. And you can go and real time implement that, and then see how it works out and make adjustments if you need to. If it works, fine. If it doesn't, then you can drop it and go back to the way you were doing business before. Very nice.
Absolutely. I love that. Yep.
And so that the self-learner or the lifelong learner, that's a big concept that I have, that I believe is, I've read more and studied more since I've been in private practice than I ever did when I was in my formal education years with dental school, oral surgeon, and everything.
Because it's so much more interesting, isn't it?
It's interesting, and it's also it's just the necessity. If you don't, you make a lot of bigger mistakes than you would already have made, and it could impact your livelihood. It could be detrimental. Gosh. So you're really on the line there. So I think that's part of it, out of necessity. And honestly, a little bit out of fear in the early stages, because you're just like, I don't want to mess up, and I want to do this right. And of course, we still make mistakes.
Absolutely. Oh my gosh, isn't that so true?
Let me ask you that then. What's been your biggest struggle as a private practice owner?
Oh boy. So I'm always the first to admit that I'm not the smartest guy in the room. I'm always the first to, I guess, frame my expertise. And the reason that people would consider me an expert is not because I'm the smartest guy in the room, for sure. It's because simply I've made more mistakes than pretty much anybody in private practice. So, I mean, my mistakes and my failures are too many to count. But my biggest struggles have always been prior to learning how to communicate and how to lead effectively, right? So if I was going to tell a young dental student the one thing that's going to make the difference, the biggest difference in whether or not they're going to be a success in their career, as far as a business owner, as far as a spouse, as far as, a member of society, it's whether or not they're a good communicator and whether or not they have a knack to be a leader, which I believe you could develop just like any muscle. Any shortcoming that I've ever had in my practices has come down to my lack of my ability to be an effective leader. And that comes down to my ability to communicate effectively. So if you can't be a good leader, then you can't inspire a team to go out and create and help you, I guess, create your vision, your ideal practice. So, I am completely immersed in resources constantly regarding how to build rapport, how to communicate effectively, how to be an effective and exceptional leader. I think that my biggest failures have always come to my lack of effectiveness in that area, and my successes have all come as a direct result of fine-tuning this craft and that knack.
And that parlays into, like you say, every aspect of your life.
Every aspect. Don't you think?
Yeah,
Russell?
and I think you and I are like-minded in this. We have some similar resources I think that we use is the accountability piece again. It shows back up.
Oh, yeah.
If things are going wrong and you're the owner, then guess whose fault it is?
Yeah.
At the end of the day, you have to take responsibility for it. And you may not have trained your team well. You may not have communicated your expectations well. But it all comes back to you if you own the practice and you're the leader of that practice. And that was a concept that I hate to say it, but was a little foreign to me because it's easy to pass blame on to someone else and to point fingers. That's something that I've struggled with too. And over the years, I've been able to hopefully adjust that in the right fashion. But I couldn't agree more.
If you could think for a second of anything, I have 10 practices. If any given day there's a number of frustrations or things that go wrong or certain fires that we have to put out. Now, if you're immediately looking for who's at fault, it's not a productive way to start the analysis and fix a problem. If you could immediately say, okay, what could we have done better here? What could I have done better here? What are my shortcomings in this particular situation? If it comes down to, two staff members not getting along and yelling at each other in front of a patient or the phone not being answered correctly, you could easily point fingers and look out the window to figure out who's to blame. But it's so much more productive, and you can fix the problem so much faster if you're looking in the mirror instead of out the window, and taking full responsibility and figuring out what you could have done better and how you could adjust yourself as far as training or resources or culture, whatever it happens to be that's going wrong in the business or in your personal life. If you take 100% accountability, it's just so much easier to correct action and correct course.
I like it. I couldn't agree more. If you were to pick, and this kind of goes along the lines of our thinking, if you were to pick one of your personal characteristics that you think's probably the most responsible for you becoming a private practice owner and the business person that you are today, what would that be?
Oh, geez. There's a couple, but...
Well, give me a couple then. I'll take two.
Okay. I would say persistence. There's a bunch of different words for it. Grit, tenacity, persistence, thick skin. All of those things. I talk all the time about the immigrant edge, and my father, I'm so lucky to be to come from the background that I came from. I got to watch my dad struggle his entire life. He came to the United States with an education and $100, and a suitcase. And he clawed and he scratched and he took nothing for granted. And we moved around the country for lateral moves in his position. He got stepped on by management and he persisted. And that, being able to pay attention to that and witness that firsthand, it was really, really valuable. And, I was not gifted with a photographic memory. In athletics, I was not gifted to be the tallest or the strongest or the fastest, but I always did really well in athletics. And it was because of grit and tenacity and just figuring out what my strengths were and what my weaknesses were and outworking my weaknesses. And I've been able to outwork the vast majority of people when I needed to. That's what I needed to do to get into dental school. That's what I needed to do just to get passing grades in dental school, was study 3 times harder than everybody else. And same thing in business. If one practice was a struggle, I wanted to prove to myself that I could have 3 successful practices. And once we did that, then I wanted to prove myself that we could have 6. And once we had 6, I wanted to prove that we could have 10. And who knows if that's going to continue, but it's just really kind of having my own definition of what success is for myself, not competing with anybody else, but pushing the limits of what I think I could accomplish.
I like what you said right there at the end too. It's your success, the way you define it, not somebody else's definition.
Oh my gosh. I mean, right. Look, Russell, there's in our profession, there are ridiculously gifted clinicians that I could never keep up with. I mean, I could learn from them, but I could never keep up with them. And there's always going to be somebody that's more successful financially. It doesn't take, it's not that difficult to find, people that aren't doing as well as you, but it's very easy to find people that are doing much better than you financially. So if you are constantly comparing yourself with other people rather than comparing yourself with the best version of yourself, you're going to live a miserable life. Comparison is the thief of joy. I think Teddy Roosevelt said that.
Nice. I think what we're talking about here, it's my thinking or my idea that a lot of what we do in our private practice, in our business, and to be successful, it all comes back down not to be self-centered in this, but it comes back to personal growth, personal development, if you will. That's a term that's thrown around kind of loosely these days, but improving yourself as an individual and building that character to move you forward, and everything comes along with you as a result of that. Do you feel the same way about that particular topic?
I really, really do. I believe that personal development is so important. And there's 2 different ways of looking at it. The millennial generation looks at personal development, I think, not to overly generalize here, but I think that a lot of people, younger people, look at personal development and they say, that's just self-absorption. That's just narcissism, constantly trying to develop yourself to be, better and better. That's selfishness. But what I really believe is if you can create the best version of yourself, and part of your mission statement is to pass your virtues and your good fortune on to the rest of society, then I think that we are justified in really, really focusing on developing ourselves to our full potential. So that's my counter to anybody who says that personal development is narcissism. It's that not if you have the right mission. If you know that the best version of yourself is going to be more valuable to society and generous with society and making the lives of society in general a better experience, then I say, hey man, everybody should be involved with personal development.
I couldn't agree more. I always use the quick analogy that you hear on the airlines. When the oxygen mask drops, you have to put yours on first and take care of yourself before you can help anyone else, or you're good to no one. And it took a little while to figure it out, to not realize that it was being selfish, but to improve yourself, you have to do that before you can help others and make an impact.
Yeah, it's so true. I see it all the time, with that whole martyrdom syndrome where, I have to do what's best for my kids, even at the detriment of myself. You have to make sure that you're a balanced individual and that you are doing what's best for yourself so that you are satisfied and fulfilled, or else you're not going to be any good to anybody else out there. There's a certain level of self-care and personal development that's absolutely necessary for survival. I believe that. Or else you'll just be so unhappy that you'll make everybody else in your life just equally as unhappy.
I've been there too, believe it or not. speaking from experience on that one. Mark, I'm going to ask you a couple more things here because I know your time is valuable there, and I appreciate it. So I'm going to jump in here and ask you, what do you think the biggest challenge that we have as private practice owners this day and age is?
Oh my gosh, how long do you have? I mean,
it's that opened up Pandora's box, so to speak. But
yeah,
when you look at our business model as the cottage industry, there's all kinds of different battles that we're fighting. But if you had to just pick one, I'm putting you on the spot there, but if you could just pick one, what do you think the biggest one is right now?
I think that the biggest challenge for dentistry in general is that we are expected to be everything to everybody, right? So we're expected to be so reassuring and charming that everybody feels comfortable around us, regardless of the fact that most interactions with patients start off with, no offense, doc, but I hate being here, and I'd rather be anywhere else besides here. I'd rather be giving birth than sitting in your chair right now.
Thank you. Heard that a few times today.
Yeah, never heard that one before, right? So we're expected to be charming and reassuring, and over and over and over again throughout the day. We're expected to be supportive and patient and responsible bosses all the time, right? We're supposed to deliver flawless clinical care. We're supposed to know the business and pay enough attention to the business side of things that we don't go bankrupt and we can cover payroll. We're expected to be incredibly gifted clinicians to the point where most people don't even know what a millimeter is, and we're working in a world of millimeters, like fractions of millimeters in many instances, and we're expected to do that to the level of precision that if we're not super precise, then we're open to lawsuit and huge amounts of liability, right? So we're expected to do all of these things and then come home at the end of the day, hug our kids, be attentive spouses and parents. It's just a whole lot to expect from any individual on any given day. Now, the fruits of our labor and our stress and the liability that we go through are greater than in most professions. But what we're expected to do and to be it's a lot to ask any individual. So I think that anybody that's involved in dentistry in general has many, many challenges. But I think that especially practice owners and then multiple practice owners in addition to that. But I do believe that if you set your life up correctly, you could take some of the pressure off yourself. If you empower the people that are around you, if you select the right team to be around you, if you have the right systems in place, then you can remove yourself as the bottleneck from your business. You can remove some of that pressure from your shoulders. You can focus on your clinical craft and not have to worry about all the other things so much. Like if you, as far as, having to be charming, if you have a great patient experience from the first time they call to when they walk in the door and you have a great support staff, and they're a happier version of what they would be if they were treated improperly, that takes a lot of the pressure off your shoulders and having to be the be-all, end-all of the patient experience for that particular patient. If you have a great business team, if you have a great billing department, you don't have to worry so much about that stuff, and you can focus on your clinical craft. If you are really good at case acceptance and you're selling larger cases, then you don't have to see 35 patients a day. Maybe you can see 10 or 8 and still make the same amount of money. Then you're happier when you go home, and your career lasts longer because you don't have a bad back. There's a bunch of different things we can do to offset some of the challenges that come along with practice ownership and dentistry in general. You just have to be intentional about it and plan for it, and don't be a victim of circumstance. You actually have to plan ahead to make sure that your life doesn't spin out of control and that the business is under control as well.
That was awesome. That was awesome. Yeah, I loved it. And I'm sitting here and I'm listening to you, and I'm in my mind checking these things off, and I'm going through my team and through my patient experience. As you're saying that, I'm like, yeah, well, we could improve there. No, that's pretty good. But no, I agree. I think another part of that too is, at least in my own personal experiences, because we have that pressure on us to do all the things that you mentioned, and I've been guilty of this, have a perfectionist mindset. Oh, sure. And that perfectionist mindset can get us in trouble because we can't be perfect at everything. We can't be perfect at anything, in my opinion. We're always working toward improving, but we can really beat ourselves up as individuals with that perfectionist mindset. And I've been guilty of that myself. And I don't know if the perfectionist mentality drives us to the profession of dentistry, or the profession makes us that way. I'm not sure which comes first there, but
the tough part is, Russell, that what got us where we are is not necessarily what's going to take us to the next level or to make us happy in our lives, right? The fact that we are perfectionists, and the fact that we're detail oriented and we're type A personality and we're super driven, that got us to where we are right now. But it's not necessarily that attitude and that drive and that inflexibility that's going to make us have a very well-rounded and happy life. So we have to be smart enough to outsmart our tendencies of type A and perfectionism, and take a big look at the bigger picture and see how we could design our lives to be happier and more well-rounded, right?
Right. That agreed. And always a journey, working that way myself. I figure most of the folks out there that are going to listen to this are at some point along the journey themselves, but you are certainly an inspiration to me. And I think a lot of folks out there in our profession that know you and know what you've accomplished. I'm still amazed. I don't know how you have the bandwidth to do what you do, but you're definitely someone that I look up to and respect as a business person, and all the things that you've done and you continue to do and influence the profession. And again, I appreciate you taking the time to talk with me this afternoon and get some insight about the ownership side of practicing the profession that we are involved with.
Yeah, thank you so much for the opportunity. Right back at you. Thank you for everything you do for the profession, and I was honored to be here today.
Well, have a good one. I appreciate it, and I'll talk with you soon, Mark.